What can be done to treat psoriatic arthritis?
First of all, it's very important to treat it, and it also depends on severity. An important thing about treatment is also diagnosis. So what we know is that if there is a delay in diagnosis, you get more severe joint inflammation and joint damage and lesser response to therapy. So it's important to get diagnosed early. And once it is diagnosed, treatment depends on the severity. If it's some patients have arthritis but doesn't bother them, the inflammation is very low or non-existent and minor, and so there really is no need for treatment. But if it's more than that, you usually begin with anti-inflammatory drugs. Although it has its own problems, if they take care of the pain, then that's all that may be required. And this is particularly true for spinal back pain, where if you have a very good response to anti-inflammatories, then maybe that's all what you require. Here I'm only talking about medical therapy. So from medications point of view, that could be one. If the arthritis is more severe than that, then it depends on what is affected. So if your hands and feet, the so-called peripheral joints, are affected, then we typically treat that with so-called disease-modifying agents, including drugs like methotrexate, sulfasalazine, leflunomide, and the more newer ones like apremilast. Now, if it's not particularly helpful, and the disease is still active, then we go on to the more newer drugs, like the biologic agents that target anti-TNF, IL-17, and now more recently IL-23. So those are found to be very useful. And then there's also an oral agent that has recently been approved called tofacitinib, which has been shown to be very effective in people who have active disease, who have even failed biologic agents. So for peripheral arthritis, these are the medications that we use. Now for the back and neck pain, when anti-inflammatories are not helpful, that's then what we use are the biologic agents, and the two that are available are anti-TNF agents and anti-IL-17 agents, although many other drugs are being evaluated. So it depends on what joints and where the inflammation is. And it's also important not to ignore the skin. Many times, the skin is managed by a dermatologist and the joints by a rheumatologist, so there might be a disconnect. So if you have a best managed, especially severe disease, is best managed when there is a good communication between the dermatologist and the rheumatologist, ideally in a combined clinic setting. So that's the pharmacotherapy of it, but that's only part of the management. Other things is good exercise is important, especially when you have significant back pain. Your overall health, your diet diet is important. Losing weight makes a big difference in controlling the inflammation and pain. And sometimes there is chronic pain without evidence of very severe inflammation, and so that might have to be managed separately. Once again, exercise, good sleep, other types of therapy, massage therapy, for example, although there's not much of evidence for using that, but for pain, that could be of benefit. So management is not just about treating the inflammation. It's a comprehensive treatment with drugs and the other things that I mentioned, so that the quality of life is much better. And you also take care of comorbidities, because patients with psoriatic arthritis and psoriasis tend to have a lot more metabolic issues, like metabolic syndrome, more cardiovascular disease, more diabetes, and of course more depression and anxiety related to the inflammation as well as pain. So comprehensive management needs a good team approach tackling all these problems.